Hey everybody, welcome to our live this evening with Diedre Bloomquist. Diedre is a visionary functional nutritionist and founder of Always Growing Wellness. And her practice is dedicated to unraveling the complex relationship between environmental toxins, fertility, and childhood health. With a deep passion for preconception toxin reduction, she empowers individuals to enhance fertility, achieve healthier pregnancies, and nurture thriving future generations. Her pediatric practice specializes in supporting gut health and eczema by screening for toxin burden, and her virtual practice supports clients across the United States to restore health by bringing their bodies back to their natural capacity. And she's also the best-selling author of Toxic Infertility, Detoxification Solutions to Improve Natural Fertility. And I've got the book right here, which is sort of our topic for today. Although Diedre did join us a couple months ago to talk about sort of eczema and skin issues in kids and even dental issues as a result of mycotoxin exposure. So be sure to look in the archives for that one. But hi and welcome.
Thank you. I'm so excited to chat through this part. I love this topic.
I know this is an exciting topic and a little more complex, I think, than our original one. But in that sort of vein, I want to just say that this is not medical advice and should not be used to diagnose or treat any disease. And we will definitely answer as many questions as we can get to, but we can't answer like personal medical questions for obvious reasons. So, okay, well, I guess we're going to jump off into the topic, and it's really the topic of reproductive immunology and how mold fits into that picture and mold exposure. So maybe you want to just kind of kick it off with talking about fertility as in pregnancy as sort of like not just a hormonal process, but an immune event and what that means.
Yeah, absolutely. So in the fertility space, it's not uncommon that when a couple is having trouble conceiving or a woman is worried about the ability to conceive, that the first place we think is about hormone health and what's happening with my hormones. So even, for instance, when you go to a conventional fertility clinic, you're being tested for things like AMH and estradiol and progesterone and being told, yes, this looks good, or no, we have low levels or high levels or whatever it is. But the way that I think about fertility is that the immune system influences capacity around fertility. So we often forget that, especially early in pregnancy, one of the key components is the shift in immune signaling. What that ultimately means is that early in pregnancy, you're actually going to be favoring a more regulatory and anti-inflammatory immune environment. So we're going to see more Th2 dominance, for instance, which is promoting tolerance of a fetus. But if the immune system is overly inflammatory or defensive, implantation can actually fail, or early pregnancy loss can occur because the body isn't able to fully recognize the embryo as something we want to protect. And this is where I often see most issues is in that first trimester in particular. So if the immune system is intolerant or unstable, maybe it's upregulated or compromised, we can't get to that place in that immune shift that needs to happen. And ultimately, early pregnancy is really reliant on very careful immune regulation, factors that are often disrupted by immune balance in the body. And then the question becomes, why is this happening? So, even right now, I'm seeing a big shift in the fertility space where we're thinking about very advanced testing as it relates to reproductive immunology, where a lot of women are being tested for natural killer cells and Treg cells and what's happening with their Th1 and Th2 balance and how that relates to oftentimes recurrent miscarriages in particular. But the deeper question from my perspective is, why is the immune system so upset in the first place? Why is this dysregulation occurring? And one of the most common things that I'm seeing in practice is some level of exposure to mold and mycotoxins. So we know that mycotoxins are immunotoxic. They dysregulate the immune system, which can look very different for different people. Some people have a compromised immune function where maybe we're seeing an overall immune system that is on the lower side and unable to mount an appropriate inflammatory response to many things. Or they have an upregulated immune response where they're just a little bit more hypersensitive to just about everything. Both of those situations can kind of create a troublesome environment when it comes to fertility. So we're thinking about the immune system as a whole. We really, from my perspective, I just want to be thinking deeper and asking better questions about if there is something happening with the immune system and the inability to either get a positive pregnancy test or experiencing recurrent miscarriages, why is that happening? And making sure that we're including mold and mycotoxins as part of that assessment.
Okay. And are most of the clients that you're seeing, are they falling into that unexplained infertility category? Okay.
Yep, absolutely. So I hear this all the time where I've just been diagnosed with unexplained infertility, and I always think about that as uninvestigated. We just haven't looked deep enough. There tends to be multiple contributing factors of which I'm sure we're going to talk about, and I go through a lot of this in toxic infertility because there are key frameworks that influence the ability to conceive. But yes, we're really thinking about these unexplained cases where we just don't know what's happening. But I do also find that when it comes to reproduction and hormones as a whole, oftentimes we put blinders on where we're just thinking about the reproductive system and really forgetting that fertility is the pinnacle of health. It's going to be the first thing that gets turned off if there is something happening internally in the body that our body's trying to deal with. We're never going to be in a place where conception is going to be open and welcoming if there is some type of internal distress happening. So I know this is this is a big theme of the things that I'm often talking about with couples is your body's not broken. There's a reason that we're not conceiving right now. And oftentimes we just have to keep digging until we figure out what those contributing factors are so that we can remove that burden and allow for that to happen.
Yeah, I mean, there's like a part in her book where she says, your body's not broken, your body makes no mistakes. And I love that because it's just, it's a more, it's a less traumatic way to think about it. And just like welcoming the mistake as an opportunity to explore sort of the deeper why, as to why all this is happening. And I also wanted to tell everyone, if you're interested, so the article she wrote for Sinusitis Wellness, we've linked to it, and that's what we're discussing if you want to kind of follow along. But the book is like the mega dive into the article, and chapters, I think it is, I've got it all marked up. 7 and 10 are the mold and mycotoxins chapters. Okay, sorry to disrupt our flow with that, but okay. So could you talk a little bit about the ways that you see, and you did a little bit before, but a little more in depth about the ways that you see mold and mycotoxins disrupt the immune system, like maybe the ways that you'd see it in testing with like the immune activation, maybe mast cells. You can even talk a little bit about how like you test as opposed to like your traditional hormone testing.
Yeah, absolutely. So big picture, the way that I think about the role of mycotoxins and how they're influencing the immune system is they can actually push the immune system either towards an excess of inflammation or an inappropriate suppression of immune function. And we know that when we're thinking about fertility, successful implantation is going to require a very specific immune balance. So just for instance, the maternal immune system has to become tolerant enough to allow the embryo to implant while still maintaining the capability of protecting against pathogens that we're all coming in contact with every day. And what happens is mycotoxins can disrupt this balance by increasing things like inflammatory cytokines, they alter T cell signaling, and they interfere with regulatory immune cells like Treg cells. So we can see this happen in a big way. But then we can also see this chronic inflammatory signaling occur where mycotoxins can activate innate immune pathways and increase cytokines like TNF alpha and IL-6 and TGF beta, which are typically things that we're thinking about for reproductive immunology testing. So if somebody has worked with a NAPRO specialist or they've done something like Fertility testing, they might be familiar with these types of markers because they're not typically tested for in a more conventional setting. But when we see these inflammatory signaling markers be elevated, it tells us that the environment of the uterus might be less supportive of implantation. And this might contribute to more presentations that look like implantation failure or recurrent pregnancy loss. And one of the reasons is that mold exposure can actually be leading to these more unexplained cases because of the way that it creates inflammation throughout the body. But like you had mentioned, it can also signal mast cell activation and histamine signaling. This is really important when we start to think about the grand scheme of things, because even fungus and mold as a whole is going to increase the production of histamine, which can disrupt uterine receptivity. It can increase that inflammatory signaling, especially in early pregnancy, and it can disrupt that implantation capacity as well. So there's a number of ways that that can happen. The other big thing that I think a lot of folks are missing when it comes to mold and mycotoxins is how they disrupt mitochondrial function. So many of us remember that mitochondria are the powerhouse of the cells. They produce ATP. Well, when it comes to fertility and egg health in particular, and the same is true for sperm health, is that these type of cells are actually highly reliant on mitochondria. So for instance, eggs require so much more mitochondria than other cells in the body. Most cells in the body need somewhere between 1,000 and 10,000 mitochondria in order to produce energy. Eggs need 100,000 mitochondria. So we have a huge energetic need. And this is partly due to the fact that in early pregnancy, we have very rapid cellular replication that's happening, right? We're creating humans from scratch. And as those cells replicate, there's a huge energetic need that needs to occur. But mycotoxins can actually impair mitochondrial function and increase oxidative stress in the process. So this is not only going to be influencing the immune system and reproductive cells directly, but it directly can inhibit the ability for that cellular replication to happen at the speed at which it needs to happen, as well as the ability to form the placenta, because during pregnancy, we're growing a brand new organ, the placenta, which has a lot of important and critical roles as we move into that. Beyond that, we can be impacting the brain, the neuroimmune system. The whole endocrine immune connection is really going to be impacted by mold and mycotoxins. So we can see a whole bunch of hypothalamic and pituitary dysfunction, as well as the adrenals and stress hormones being signaled differently. Cortisol and stress hormones are going to be influencing immune regulation even further. So there's so many different ways that mold and mycotoxins can be impacting the systems that are really important when it comes to fertility and the ability to just get to that positive pregnancy test.
Okay. And so what type of immune testing are you doing? Are you doing kind of what you were talking about for like IVF or?
Yeah. So we really do look at just a complete blood count and differential when we're looking at immune function from a systemic perspective. That can give us a lot of information. We do frequently see clients who have done more in-depth immune testing, as far as something like Fertility testing with their NAPRO specialist. The thing with NAPRO is they're really looking more at immune function and thinking about if there is suppression happening or overactivation. But when it comes to NAPRO technology, we're really thinking about how do we use more medications, like steroids, for instance, to suppress immune function when it is overactivated. Whereas what we're doing is really thinking about why is the immune system overactivated in the first place. So one of the key tests that we're typically running with clients is doing urine excretion toxin testing to determine, is there a mold issue? Are we actively being exposed? Do we need to be looking at testing a home, or is there potentially a colonization of mold happening in the body where we are now producing mycotoxins from the inside out that need to be addressed? And by doing detoxification of mold and mycotoxins, as well as other toxins that we discussed in toxic infertility, mold is really one of the big drivers that we're seeing cause a lot of this immune dysfunction. As we do that detoxification, the immune system can come back into balance. So we can kind of see that happen over time, and then obviously presents very differently when we get into a conception situation.
Are there some key red flags on like a CBC that kind of tell you it's mold over some other toxin?
Yeah, absolutely. One of the most common presentations that I see is women in particular will feel great. They don't really have a ton of complaints. Now, I do occasionally see that women will have like gut dysfunction that kind of relates to mold, or they have some level of thyroid dysfunction that's kind of been swept under the rug. And, even earlier today, I was talking to a couple who's gone through IVF and had a couple of those things come up, and they've been just ignored because we're really focused on the reproductive system. So when I'm looking at a complete blood count, I'm always looking at white blood cell count first. If I see it low, which is the most common presentation, lower than 5, I'm really thinking about the immune system being compromised and then thinking about why that might be occurring. So from there, I'm then looking at the differential. So the differential tells us more about different types of immune cells throughout the body and what they might be mounting a response to. Key ones that I'm usually looking for are going to be monocytes in particular. If I see monocytes above 7% personally, that's where I'm starting to think that there might be a fungal issue happening in the body, whether it's an ongoing exposure or an internal issue that needs to be addressed. But I'm frequently also looking at things like vitamin D. Is it low? Why is the immune system depleting vitamin D so quickly? Looking at liver enzymes like AST and ALT. If those are elevated, it tells me that the liver is in a state of distress and is producing those enzymes to help with inflammation somewhere in the body. Even looking at things like iron anemias and iron deficiencies. If we're starting to see that, well, we often forget that mold can deplete iron throughout the body because it is reliant on iron just like we are. So when we start to see all of that kind of pattern pick up, because it's not always just one marker on blood work that gives us a clue, but it's more of patterns that we're looking for to determine, yes, this makes sense that we should be testing for something like mold to determine if that's a factor in this case.
Okay. And then with like the mycotoxin testing, so you typically use the urine testing, and I know there'll be this question, so I'll go ahead and ask it. Do you provoke? Do you do things to provoke sort of excretion before testing?
Great question. I don't usually do any provocation. The reason that I don't is we do see a variety of client presentations. So people who are more sensitive, who are generally presenting more sick as a whole, and I never want to provocate, not knowing how long it's going to take for me to get test results back and get a protocol in place for them to restabilize more than anything. And I personally use Vibrance urine toxin testing, and it tends to be a little bit more sensitive and doesn't require provocation.
Okay, that's great. And then the other thing I was going to ask too is if you've got someone that, and also, do you want to talk about environmental testing that you recommend? I know sort of a very baseline, and I've got these as like a little prop, but I know she recommends our test plates. So
Yep, absolutely. Yep. If we're really on the fence of like, is this something that we need to look into? One of the things I fully recognize is inspecting a home for mold, whether you're doing a professional building biologist inspection or even doing something like an ERMI or an EMA, is those are some higher ticket items, right? And a lot of times we're just not sure if it makes sense. So one of the first steps that we can recommend is doing plate testing. If we're doing plate testing as an air sample and we do catch mold spores that are growing after the week, we know that we need to explore further testing where it might make sense to do either an ERMI. We also often recommend an EMA test from real-time labs or even a dust test. So that can be helpful. But the other way that I often like to recommend using the mold plates is to use them as tap tests and tap them against things like carpet and rugs and furniture, because those tend to be more sponge-like and porous materials. If there is an issue in the home, it's going to give us a pretty good indication of needing to dig deeper into those areas.
Okay. And then the other thing I was going to ask too is in your article, you talk about this, but if you want to kind of go a little more in depth about sort of the two molds that you see most common as factors in sort of like the reproductive immunology piece of it.
Absolutely. So the big one that I commonly see that I really like to draw attention to because I don't feel like it gets enough airtime is zearalenone. Zearalenone is an estrogenic mycotoxin. So what it does is it's non-steroidal, but it mimics estrogen in the body. Not uncommon that a lot of people who are otherwise healthy and mindful about their diets and their lifestyles are going to have high ZEN. Part of that is because it can come from Fusarium mold, which is commonly found on contaminated grains, to include things like oats, barley, and rice. So very common that we'll see this where somebody has made a otherwise good decision to reduce gluten intake, but instead is now relying on other grains like rice. And what happens is this mycotoxin can change the way that hormones function throughout the body. So for instance, I see oftentimes that women will feel like they have symptom presentations that mimic estrogen dominance, where maybe they're having heavier, painful menstruation, they're experiencing breast tenderness and PMS, and they're just sure that they have estrogen dominance. But then when you look at hormone testing, they actually have an estrogen deficiency and they're stumped. Why is this happening? And what happens is the brain has a negative feedback loop. So essentially, it is perceiving that these estrogen receptor sites are being impacted by ZEN, where it is being bound, presenting in the body as estrogen, and therefore downregulating the endogenous production of estradiol, which is very important when we think about not only hormones as a whole, but fertility, because we have to have adequate estradiol to not only support ovulation occurring so that we can select a dominant follicle, but then also thinking about maintaining receptivity and uterine lining throughout the course of the cycle as well. So very common that this is a little bit of a confusing one, because we think about estrogen must be too high, and so we do things to drive it down further, not realizing that it's not actually a dominance issue, it's more of a deficiency issue, and mold is kind of playing a trick on us as part of this process. The other one that I often see, it's not uncommon that you'll see a lot of ochratoxin A. Ochratoxin A is frequently coming from homes. It can come from foods as well, but not uncommon when you're seeing really elevated levels that it is coming from a water damage building situation. Where it's coming from food is going to be your grains. It's also very commonly found in contaminated coffee beans. It's estimated that somewhere between 70 and 80% of coffee beans are contaminated with ochratoxin, which is then being introduced into our bodies and causing more of a not only mycotoxin exposure issue, but can cause colonization throughout the body, depending on how much coffee you are consuming. But really common to see in homes because it's produced by both Aspergillus as well as Penicillium species in water damaged homes, which are some of the most common species that cause mold toxicity in homes. So those are the two ones that I'm really thinking about, and ochratoxin in particular can cause a lot of neuroinflammation and impact the ability of the immune system to be regulated by the entire nervous system as a whole. As well as the ability to communicate with endocrine glands. So not uncommon that you'll see miscommunication between the brain and endocrine glands, whether it's the ovaries or even the thyroid and the adrenal glands, because of the way that the pituitary in particular is being impacted by mold.
Yeah, and that's sort of like that, also that inhalation piece. We kind of talked about that in our other live, and addressing the sinuses and all the importance of that. Well, are there symptoms with your clients that come to you that have, like have quote unquote normal hormones, normal everything, kind of like indicative of maybe looking at mold as something that might be causing their issues?
Yeah. The tricky part sometimes when it comes to a symptom presentation is it's not uncommon that women in particular will not have any symptoms of there being a mold issue. So for instance, there's been a number of couples that we've worked with over the years where when they came in, they were like, I feel great. I have no symptoms. I have no gut health issues. Energy is awesome. I crush it at work. I feel amazing. And does it make sense to do toxin testing? And what I can tell you is that those types of presentations where somebody is completely asymptomatic actually tend to be some of the worst toxin tests that we see. And part of that has to do with the fact that I think a lot of people are handling that type of toxin burden incredibly well. And there tends to be patterns. So it tends to be your type A woman doing all the things, feels really good, has good routines, eats well, takes care of herself. And because of those other lifestyle factors that have been put in place, you won't always see symptoms. And so I say that to say, if you don't have any symptoms, don't immediately rule out mold as a factor in your situation just because you might be handling it very well. Outside of that, the big things I'm usually thinking about as this might be a factor. Anytime I hear somebody has had more than 2 miscarriages, I'm thinking about mold and screening for it, if nothing else, just to rule it out as a factor. But typically there's going to be some level of GI dysfunction. So usually that looks like bloating, sometimes gas. Oftentimes there can be a prior SIBO diagnosis in place. It can also look like constipation, because we know that mold can change the way that motility happens and the speed at which peristalsis occurs. So we can see more constipation, even if it's not severe, just a tendency towards constipation. We can also see a lot of cognitive and neurological dysfunction. So sometimes it just starts as a little bit of brain fog or a little bit of fatigue, or I just feel like I'm not getting as much sleep as I used to. And in worse scenarios, it can look like regular headaches, migraines, or more of the instances where we're losing our words, not remembering where we were, what we should be doing, walking into a room and not remembering why we went there, things like that. Can also see a lot of thyroid antibody production as well. So oftentimes we forget that when it comes to autoimmunity, that is an immune event. So it's not uncommon that many women have been diagnosed with something like Hashimoto's or Graves', not realizing that that is an immune event that's happening to the thyroid specifically. So really thinking about why that might be occurring and why antibodies are being produced and what the body is essentially trying to clean up, kind of what we were pointing to earlier with the body not making any mistakes around anything. Also can see changes in menstruation. So not cycles might look perfect in terms of length and duration, but maybe we are seeing more painful periods occur, more breast tenderness, more PMS. What that tells me isn't that we're looking at an estrogen dominant perspective, but we're really thinking about a burden on the liver and why we are unable to withstand and metabolize and eliminate endogenous hormone production the way that we may be used to. So especially if that's shifting over time, that can be a clue that maybe there's a new exposure or things are building internally that the liver is needing to deal with.
Okay. And then I wanted you to talk a little bit about, I know we can't give, it's so individualized, and I fully understand that because you treat the person like not sort of like the bigger, like some bigger disease picture. But you've got a case study in your article that I think would be helpful to talk about sort of how you addressed it with that particular client and how, you know, it helped her. And I mean, these are like generalized ideas on like interventions and things when Diedre talks about this, but I mean, just maybe some ideas on, you know, maybe how to address a possible mold piece if you're kind of dealing with this.
Yep, absolutely. So the way that I typically think about this is figuring out what's happening in your body first so that you can determine if you need to explore a current exposure. And I think part of the mold conversation feels very overwhelming for people because of the fact that it feels like remediation is such a big topic and such an overarching, like, feels like a burden. And it doesn't always have to be. So the way that I approach this is doing urine excretion testing first, determine what type of mycotoxins are present and how that might be connected or not connected to the symptoms and the presentation that we're seeing from a fertility perspective. If we do see that there are water damage based mycotoxins, at that point, moving into testing. So in the case that we discussed, we did the microbalance mold plates testing of her home. The results came back very severe and she went straight to, we have to figure this out. So she got an inspection, went into full remediation to fix things there. From there, we're really thinking about how do we modulate the immune system and how do we address the toxin issue to support detoxification effectively. So the way that we build protocols for clients is really looking at supporting detox organs first, making sure that we're supporting cell membrane health, because oftentimes when it comes to mycotoxins, we create what's called cell danger response, which means that cells become very rigid. We aren't able to release things like toxins, but we're also not able to absorb things like we need, like nutrients, especially for fertility. Supporting mitochondrial health so we can produce the energy needed to support detox is really important as well, because detox is very energetically demanding. So we have to allow mitochondria to work well. From there, really going through a phased approach and listening to her body was very important. And this is true for everybody. Some people can move through a detox protocol, no problem. They just smooth sail, they feel great the whole time. And others, we have to move very slow, really pushing forward and scooting back as it relates to how they respond effectively. Mold is very different than doing other types of work like gut work, because a lot of people feel like, okay, I'm having a die-off or a Herx reaction, I just have to keep pushing through it. And we don't want to do that with mold because it can actually cause more harm than good. So really thinking about what type of binders are we using? That's going to be based on mycotoxin testing, because not all mycotoxins are bound by the same thing. Do we need to address colonization and utilize antifungals, whether they are herbal or fatty acid based, to actually kill any fungus internally in the body that's producing mycotoxins, and then restoring balance? How do we modulate the immune system? How do we replenish gut health? How do we heal and seal things so that we can then give them the green light to go into trying to conceive?
Okay, that's so helpful. And then, you know, I think before we answer questions or get to everyone's questions, you kind of talk at the end about like why the preconception mold recovery matters. And I think, you know, a lot of people are thinking about mold in terms of bringing an infant into the home versus growing the infant in your body, or even just conceiving the infant. And so, you know, why this piece matters really for anybody thinking about starting a family or having another child.
Yeah. This is super important. And part of how I became so passionate about this is exactly what happened to me. I didn't realize that I needed to assess myself for things like mold and mycotoxins prior to getting pregnant, because what happened is I ended up giving that all to my little boy while in utero. So even though he was incredibly healthy, he got all of my toxin burden, which meant that he started life with a lot of toxins, for one thing, which we see a lot in our pediatric practice where kids are inheriting this from mom in a big way. But it also means the immune system isn't able to be as resilient as it needs to be during early childhood, where you're going to see kids with more gut issues and eczema and immune dysfunction and allergies and asthma and everything that comes along with that whole atopic march. So this is a really important factor of just thinking about what we're all being exposed to, and the fact that it's not always going to present as we're somebody who's sick. And I can even say that from personal experience. I was a super healthy person. I didn't have any symptoms before my little boy got sick. And then once I started looking at what was in his body and what was in my body, it all made sense that it had come from me accidentally. And this not only is drastically improving the ability to conceive and the speed with which we see couples conceive, but we're also thinking about improving pregnancy health. So not only reducing the risk of miscarriages, but also thinking about how this is going to influence things like gestational diabetes during pregnancy. So we know that mycotoxins are hepatotoxic. They're impacting the liver. The liver is incredibly important when it comes to managing blood glucose. If we're not able to manage blood sugar, we're at a greater risk for gestational diabetes. We can also see nutrient deficiencies because we're not able to chemically digest food due to mold in the body. That's going to influence things like preeclampsia risk. So we're not only thinking about that. We also have to remember that even if we are considering that there's a hormonal issue, pregnancy and birth are all hormone facilitated events. So if we have a hormonal issue preconception where we're only using something like Chaste Tree or Vitex or progesterone supplementation to fix that issue, we're missing a huge opportunity to improve pregnancy and birth outcomes, to ensure that the whole birth process goes according to plan, that women can breastfeed if they would like to, because that's facilitated by hormones as well. And then thinking about how this all transfers to our children as well, so that the next generation of kids can be as healthy as possible.
Yeah, and I would think like once you have the baby too, that hormonal balance that allows you to recover emotionally, and I mean, I'm sure it does affect how it impacts you, like, even the hormone fluctuations that happen with people that have like depression after pregnancy and things like that. So
absolutely. And there's a lot of data that shows that a lot of postpartum anxiety and depression has to do with nutrient deficiencies, especially as it relates to minerals. Those are a big thing that we're being depleted of because of toxin burdens as a whole. Just because they can displace a lot of these things and deplete us, especially for even just iron, right? If we're thinking about iron anemia and being at risk later in pregnancy for needing an iron infusion, or being at risk for hemorrhaging, that's really important and something we can start thinking about preconception and not waiting until we have a problem to deal with.
Yeah. And I'm sure it's, a lot easier to address with your clients, like preconception versus during pregnancy, because there's a lot more you can do.
Yep, absolutely.
to help them.
Yep.
Okay, well, we're going to get to questions, and we're going to start with the ones that were sort of sent in first. Okay, there's the first one. Would you still try to conceive while you're working on getting rid of mold? If not, what is the metric you would look to know you're in the clear?
Great question. So our recommendation is typically that we're not actively trying to conceive when we are working on detoxing and getting rid of mold in the body. Now, part of that is coming from the fact that we know that this increases risks long term. What I typically recommend is taking a look at what's happening in the body from a toxin burden perspective and making a decision to either prevent conception from happening or being really mindful of things. And what I will say is it's not uncommon that we'll see clients who accidentally get pregnant in the middle of their protocol, because what happens when you're doing detox work is hormones shift, ovulation shifts. And so sometimes accidents can happen, and that's okay. If possible, preventing is always what I recommend until you get to the end. What I typically recommend at that point is doing a mycotoxin retest to see that levels have come down. But the big thing to keep in mind is that we're not necessarily looking for a perfectly clean test. we're all still going to be exposed to mold at some point in time through food and water, and we go to the grocery store or the library, or, like, there's mold everywhere. We're not going to be able to avoid it. But we want to make sure that those really dangerous ones, especially if they have been elevated historically and they have linked risks to miscarriages and perinatal outcomes, that we're seeing those come down within reason so that we can move forward and have the green light for trying to conceive.
Let's see the next one. How does this impact women in perimenopause? Would love to hear more on how to support hormones post mold exposure in later years.
Yep. I love this question because I don't think it gets enough attention. So when I think about perimenopause and menopause, one of the big things I'm thinking about is the fact that we often hear that you stop producing estradiol and progesterone. This isn't the whole truth. So what happens is the ovaries discontinue the production of both of these hormones, and the adrenal glands take over. They're producing a much smaller amount, but a very critical amount. And where we start to see difficulty shifting through that perimenopause season is when the adrenals are in a state that they're unable to continue that production. So I'm more so thinking about people who have had chronic stress, whether that's external or internal in the body. And what we know about mold is that it impacts the hypothalamic, pituitary, and adrenal axis very significantly. So it changes the way that stress hormones are being produced and released on a regular basis, as well as how we just perceive the world and how our nervous system functions as a whole, because these are neurotoxins. So when we start to see that shift happen and we move through perimenopause, if the adrenals are unable to pick up that slack for us and help with that production, it makes it very difficult to see that output be adequate, where it might always mean that we needed to be doing some level of bioidentical hormone replacement therapy, but we want to be able to see it take over as much of that burden as possible. And if that has been the case historically or on an ongoing mold exposure, it just might mean that we need additional support from an adrenal perspective more than anything else.
I have a question to tag on to that. So when you do make the decision to introduce bioidentical hormone therapy, does that mean that that's going to be forever once it's introduced?
It doesn't necessarily mean it has to be forever. I do typically think more about like testosterone pathways as being a forever situation. But with more estradiol and progesterone, it can be something that fluctuates over time for sure.
Okay. Just curious. If someone can't get out of a moldy environment yet, but still wants to get pregnant, do you have any tips?
Yep, absolutely. So my recommendation is always to try to get out if possible, or think about remediation in a different way. So I think oftentimes we think about remediation and it's this big overarching umbrella term, which means that we are removing the mold source as part of it and doing decontamination as the other part. Now, where we get into trouble, I think, with remediation is it feels like if I'm living in mold, I have to gut my house and I have to get rid of all of my personal belongings. And this simply isn't the case for most people. For most people, there is a variation of normal that might mean we need to really be focusing on removing the mold source as the first line of defense. So one, I think that perspective shift can be incredibly helpful for figuring out where is the issue and can I just remove it, even if it means it's not perfect. That's going to reduce what we're actually being exposed to long term. The reason I make that recommendation is if we have mold that is impacting your health, it's also going to impact a small child. And what happens with small children in particular, because their bodies are so much smaller, is they become toxic so much faster. So it's not uncommon that we'll see people who maybe have been able to get pregnant very easily, or maybe they've had struggles for a number of years to conceive, and they don't actually realize that there's mold in their home until they have a baby, because they start to get sick and they have eczema and they have respiratory issues or constipation or neurological dysfunction. And then they realize, oh, this is actually a much bigger deal than we thought it was. Now, that all being said, if we have a moldy environment, it doesn't mean we can't make really meaningful changes to improve outcomes. So I'm always thinking about HEPA filtration at a minimum if we can. It does not always need to be a fancy air filter. I love the fancy air filters. They are very effective and they can be expensive. So if that's not on your budget, it can even be as simple as getting a HEPA filter and duct taping it to a box fan. That's going to increase purification of the air to improve what we're actually breathing in, not only from a mold spore perspective, but also the mycotoxins and volatile organic compounds that they produce as well. Outside of that, we really want to think about like fresh air. Super simple, right? It's free too. Open windows, regardless of time of year. open your doors, have air filtration throughout the home. That's going to help improve indoor air quality in a really big way so that we're not constantly breathing things in and it's not just accumulating. We actually have an outlet for those type of toxins.
Yeah, I mean, we've had customers do some Band-Aid things that really made big differences, like, you know, removing carpets from bedrooms. And that lowered the load like tremendously. I mean, they're temporary, but
totally. Yeah.
Definitely more than nothing.
And just to echo that, I've seen a lot of clients who maybe are renting in an apartment and they aren't able to get out of their lease and they know that there's a mold issue. It doesn't mean that they can't see huge symptom improvement and huge toxin burden load decrease by just doing those things.
Yeah. Filtration, fresh air, dehumidifiers.
Yep.
You can make a big difference.
Yep, absolutely.
Okay, what do you recommend for cleaning to decrease environmental toxins when pregnant?
Yep. So for cleaning solutions, I do love the microbalance mold spray. I use that all the time, even from like a laundry detergent perspective. I love that as a laundry additive. That can help in a huge way. Other cleaning solutions, one of my favorites, I have a couple of favorites and I'll tell you all of them, but one of the ones I really like is hypochlorous spray. It can be a natural disinfectant. You can use it on a lot of different surfaces. Really effective, super safe during pregnancy. There's a number of brands like Branch Basics that can be really helpful. You can use more like foggers that you can put different solutions in. We're really just thinking about lowering the load and really avoiding things like fragrances during pregnancy that contain things like phthalates and parabens that are also going to be endocrine disrupting and disrupt that hormone process as well.
Yeah, I mean, we tell people to try to avoid bleaches, quats, things like that.
Yep,
things
absolutely.
Like largely toxic. Okay. Can miscarriages be linked to mold?
Yes, absolutely. There's a number of different factors that are involved when it comes to miscarriages. What I hate to see happen is when couples are told that miscarriages are just bad luck and to just keep trying. There is a huge immune event that happens, obviously, which we've discussed, that can contribute to the ability to conceive past the first trimester, but also all the way to full term. And we know that mold can be not only toxic to the immune system and the ability of the brain to communicate to all endocrine function as a whole, but it can cause disruptions throughout the entire body. So when we think about miscarriages, we often also hear that it's a chromosomal abnormality, and that can certainly happen. But we need to remember that when we're thinking about genetics, we're really thinking about this from a perspective of epigenetics, meaning that environmental toxins are going to be the triggers for the presentation and expression of genes to happen this way. I can't tell you how many times I have seen couples have miscarriages, even late-term miscarriages that ended up being a mold exposure that was missed until after the fact.
Yeah. I have my own story with that, but yeah, I can attest to that. Yeah. Is eliminating grains enough to deal with the estrogen mimicry?
Great question. Sometimes, yes, it is a huge factor, and it's not always that we need to eliminate grains. Grains aren't inherently bad, but we have to be mindful about the contamination load and how much we're taking in. So typically when I'm thinking about grains, if I were to see something like ZEN or a mycotoxins that's carried by a grain, I'd be thinking about how can we consume that more in moderation. So maybe that's 3 to 4 servings a week, for instance, rather than 3 to 4 servings a day. That being said, it may not account for colonization in the body. So yes, reducing these and the ongoing mycotoxin exposure can be reduced, but we might not be able to address it fully if it has already colonized the body and we now have that type of mold fungus living in the body where it's continuing to produce mycotoxins and disrupting liver function and immune function and thyroid function, all of those factors.
Okay. Because I think some of the nutrition information now too, especially for women, is to not be so afraid of carbohydrates because we truly need them, for energy production and kind of to function much more so than men. So I know we even at Microbalance, we get a lot of questions about the best diet for kind of mold. And you do address that in your book, I would like to say. There's some diet pieces in there too, and even some recipes if you're looking for that. So
Yep. And I do think that carbohydrates are important. So I don't find that a low carb diet for women is effective. It'll actually disrupt hormones in a completely different way. And it can really disrupt mitochondrial function as a whole. So I do think that carbohydrates are incredibly important. The way that I would approach carbohydrate intake is less from a grain perspective and more from a like starchy vegetable perspective. Thinking more potatoes, whether they are white or sweet potatoes, thinking more root vegetables. That's going to be a way for us to get the caloric needs that we need from a calorie perspective and having those make up the majority of the diet. And then still being able to have grains in place, of course, too, but just being less reliant on them from a carb perspective.
yeah, and another follow-up question is like I know that there is like a large mold group where carnivore is the go-to diet regardless of your focus. It's more from like a Sears mycotoxin perspective, but from a reproductive immunology perspective, I don't know. Can you speak to that at all? How do you feel about that?
Yeah, it's not something I typically recommend, and I don't always see it be effective long term. And the other thing that I'm always keeping in mind in the fertility space is when couples want to conceive, they want to conceive yesterday, not, in a year. And so I'm trying to do as much as possible in a short period of time. So really thinking about maintaining stabilization of hormones and mitochondria while doing the detoxification work rather than doing a really severe macronutrient deficiency diet like the carnivore diet or even thinking about something like a keto diet, right? There's a time and a place, I think, for all of those dietary restrictions, but it really just depends on what the short-term goals are and what your timeline looks like. If you want to conceive in 2 years, how you support your body might look very different than somebody who wants to conceive as quickly as possible.
That makes a lot of sense. Okay. If chastity fixes breast tenderness, could mold still be an issue? I'm so sorry. I thought that was going to say something.
It's all good. So chaste tree is vitex. This is an herb. It's typically thought of as supporting progesterone output. So commonly I see this used in the hormone balancing space where we're thinking about there being something like estrogen dominance or at least relative estrogen dominance where the progesterone is not adequate enough. So this is a really common recommendation. But this also drives to the deeper issue of, let's say that it does help. Why is progesterone low in the first place? So I always think about progesterone being a byproduct of ovulation. We don't actually produce progesterone at adequate levels if we're not ovulating. So with that in mind, if progesterone is low and you're seeing chaste tree be effective for reducing breast tenderness, that means it might be offsetting some of that imbalance between estrogen and progesterone, which is a good thing. But it doesn't point to, is this a progesterone deficiency? Is this a liver dysfunction issue? And for both of those, why are they happening in the first place? The other thing worth mentioning is that chaste tree isn't something that is typically recommended for use throughout pregnancy. So while it might help somebody conceive, you then can't use it going forward. And what often happens is we have this drop off, right? Where maybe we're boosting progesterone, conceive, and then progesterone dips down, and progesterone being deficient is one of the top factors for miscarriage.
That's great information. Do you know of any grains that are mycotoxin tested?
That's a good question. And I don't know that I do, honestly. Part of the problem is because it's not always that they are inherently contaminated, but somebody should make that company because we test coffee. We test coffee for mycotoxins to have mycotoxin and mold-free coffee. So it would be a really great idea. I think part of the problem with grains is the way that they are typically harvested and stored. They're harvested in kind of a damp state, and then they get put into containers where it's dark and damp, and then mold grows.
Yeah. And I know that there are some companies that are now labeled like with granolas and things as glyphosate free. So I mean, that would be really helpful. I mean, I will give you a little tip. I mean, with things like rice or even like lentils, you can soak them with water and Citra Drops dietary supplement, and that will help with any like mycotoxins on them like before you cook them. Now, that doesn't mean like they're free of mycotoxins before that, but a 5-minute minimum in the soak, though. It can't just like be, you need to let them sit in it for a little while. So,
Yep, absolutely.
Would you consider working with someone without doing blood work?
No. And the reason is that I want to know what's happening in somebody's body from a systemic perspective. And this is not only just a toxin issue. We can know exactly what toxin burdens are, if there's a mold issue, what needs to happen at that point. But from a safety perspective, it's really important to understand how somebody's biliary tree in particular is functioning. So I'm really thinking about the liver and gallbladder. This is a big system that gets impacted when it comes to mold and mycotoxins. And I want to make sure that we aren't in a state where the gallbladder is in trouble, where we're at risk of stones or gallbladder attacks, but also high level liver dysfunction. One of the things that I think often gets missed is we want to make sure the liver is in a good place and supported effectively. Otherwise, anytime we kill any organism in the body, mold or otherwise, all of those toxic byproducts of the breakdown of those cells have to move through the liver. So that's what you commonly feel is like more of a die-off or a Herx reaction. If that's not being supported effectively when it comes to things like bile flow and phase 2 detox pathways and even elimination pathways, it just means that things can recirculate and it can become very dangerous very quickly. So having some level of blood work can be incredibly insightful for the speed at which we're able to move through a detox protocol.
Yeah, and I would also assume like with measuring progress, because if you don't know where you start, how, it's kind of like how do you measure when you're there?
Yeah. Yep.
when you reach the end. So
Yep, absolutely.
Okay. Thank you. Is that it on the questions? I think it is. We got to everything. I'll look really quick. Okay, well, and we're going to mention that following up on this live, we're going to do a social post where you can win a copy of Diedre's book and then a mold screening test kit. And it's just going to be like you just comment or like tag somebody for an extra entry. So if you're interested in those two things, you can win them. So just stay tuned for a social post from both of us. But to get in touch with Diedre, you can, all of her contact stuff is linked at the end of the article. And your website is Always Growing Wellness. Okay.
It's always-growing.com.
Okay. Always-growing.com. Okay. Well, thank you everyone for joining us and hope you learned something and we'll see you next time. Bye.